A total of 77 fresh cases of coronavirus are reported from the state today. Dimapur reports 74 new cases, while Kohima reports 3 fresh cases. Deputy Commissioner Kohima lifts total lockdown within Kohima municipality area. Shop timings and opening days, odd and even rule for vehicular movements to remain in force. And India records over 60,000 cases of COVID-19 in the last 24 hours for the first time. Total COVID-19 tally gallop past 20 lakh today. Well, those were the headlines. Hello and welcome once again to this news broadcast from News and Trends. We begin this bulletin by taking a look at the COVID-19 update from the state. Nagaland today reported 77 fresh cases of COVID-19. The new cases were reported from the 2 worst hit districts affected by the coronavirus, Dimapur and Kohima, with majority of the cases reported from Dimapur. A total of 74 cases were reported from Dimapur alone, while Kohima showed a dip in its daily tally of the virus, reporting just 3 cases. This was informed by State's Health and Family Welfare Minister S. Pangyuphom in his tweet this afternoon. The minister tweeted saying 77 cases of COVID-19 positive have been confirmed out of 707 samples tested, 74 in Dimapur and 3 in Kohima. He said contact tracing is fully put in force and all primary contacts are kept under self-isolation to avoid further transmission. Meanwhile, the minister also tweeted to inform that news circulating in social media that 22 legislators have tested positive for COVID-19 yesterday was absolutely false and baseless. In his couple of tweets late last evening, the minister said in these times, people should not take advantage of the situation and spread rumors without ascertaining facts. He said such unbecoming actions only fuel speculations and fear to the general public. The minister also sounded a warning, saying that spreading false rumors will invite legal actions as per provisions of law. Let us all work together to allay the fears of the general public, he appealed. Dimapur continues to remain the worst hit by the COVID-19 pandemic. Armed forces have contributed to the majority of the cases, especially in recent weeks. Principal Secretary Home Abhijit Sinha, in his daily briefing on COVID-19 update yesterday, informed that in view of a large number of paramilitary personnel testing positive in Nagaland, the paramilitary has decided to reschedule the induction of the personnel from outside the state as a precautionary measure. Since July 23rd, Dimapur has reported 989 cases. Today's addition of 74 fresh cases in Dimapur takes the district's tally to 1,421. 255 persons have recovered, 2 deaths have been reported, 1 migrated, and active cases at 1,163. Meanwhile, the Senior Medical Officer, Community Health Center, Medziphema, Dr. Nosezol Sezo, has notified for temporary closure of all services, indoor, outdoor, and emergency services at the CHC with immediate effect. In a notification, the SMO said that this was initiated as a precautionary measure to carry out sanitization of the hospital and testing of hospital staffs for COVID-19. Meanwhile, Chairman of the Hospital Management Committee, Miatho Crosse, informed News and Trends over phone that a patient under treatment at CHC Medziphema was tested positive for COVID-19 yesterday. According to the chairman, the samples were sent to BSL lab and results came in as positive after 5 days. Crosse said that the patient has been reportedly taken to Dimapur to be admitted in a COVID care center. He also informed that the patient had been admitted almost the same time with the patient who died of COVID-19 on 21st of last month. Although they did not share the same room, as a precautionary measure, the test for the patient was also conducted, which turned out to be positive, Crosse informed. The chairman said that the CHC will be sanitized and the entire staff will be tested, and till such time the CHC will be closed temporarily as a precautionary measure. He however said that with just this lone health center in the entire subdivision, it would be difficult to close down entirely, and therefore he said the staff will be present at the health center to attend to emergency services. In the state capital Kohima, the total lockdown, which began on 25th July for 2 weeks, ended today. Deputy Commissioner Kohima Gregory Tejawale, through an order issued today, lifted the lockdown with effect from tomorrow. However, the Deputy Commissioner informed that the opening days and timing for market will remain under the same terms and conditions stipulated in his order dated 18th June. And also the odd and even rule for vehicular movement as specified in the order dated 15th July will continue to remain in force till 31st August 2020. The district has so far reported 564 positive cases, out of which 155 have recovered, with 408 active cases. One person has migrated. According to the Health and Family Welfare Department, the state's tally of total positive cases now stand at 2,657. 7 deaths have been reported, 2 have migrated, 824 have recovered, and active cases now stand at 1,824. Now let's take a look at the COVID-19 update from the country, the region, and from across the globe. Registering over 60,000 cases in 24 hours for the first time, India's COVID-19 tally galloped past 20 lakh today, while the number of recoveries surged to 13.78 lakh, according to the Union Health Ministry data. According to the Health Ministry data updated at 8 am, 62,538 cases were added in a day, taking the total coronavirus caseload to 20,27,074. The death toll climbed to 41,585, the data showed. At the same time, the number of patients who recuperated from the disease surged to 13,78,105, taking the recovery rate to 67.98%. There are 6,07,384 active coronavirus cases in the country presently, which comprise 29.96% of the total caseload. Case fatality rate has further dropped to 2.07%, the Union Health Ministry said. Maharashtra has reported the highest number of cases, followed by Tamil Nadu, Andhra Pradesh, Delhi, Karnataka, Uttar Pradesh, and West Bengal. In the northeast, Assam has reported 52,817 cases of the pathogen. A total of 5,853 cases have been reported in Tripura, 3,217 in Manipur, Arunachal Pradesh 1,948, Meghalaya has reported 990 cases, Sikkim 829, and Mizoram has registered 539 infections so far. The overall number of global COVID-19 cases has increased to over 19.08 million, while the deaths have topped to more than 7.14 lakh, according to the Johns Hopkins University. The US accounted for the world's highest number of infections and fatalities at 48.82 lakh and 1.60 lakh respectively. Brazil came in second place, followed by India, Russia, and South Africa. In other news, actor Rhea Chakraborty arrived at the Enforcement Directorate office today for questioning after the agency rejected her request to postpone the investigation into the money laundering allegations related to Sushant Singh Rajput's death. Chakraborty had asked the agency to delay its investigation until the Supreme Court finished hearing her plea seeking the transfer of the FIR against her from Patna to Mumbai. The Enforcement Directorate has filed a money laundering case against the actor over suspicious transactions amounting to Rs 15 crore from Rajput's account. Chakraborty was asked to appear before the agency to record her statement today. Chakraborty arrived at the Enforcement Directorate office in Mumbai just after 11:30 am. The Enforcement Directorate will investigate the allegations of the misuse of Rajput's bank account. It will probe whether anyone used Rajput's income to launder money and create illegal assets. Yesterday, the Central Bureau of Investigation filed a first information report against Chakraborty and 5 others in connection with the death of Rajput, whose body was found in his apartment in Mumbai on June 14 after what the local police said was a case of suicide. The CBI has now taken over the investigation on the request of the Bihar government. However, Chakraborty, who has denied all accusations against her, said the Central Bureau of Investigations should stay away from the case till the Supreme Court has given its verdict on the matter. She claimed an investigation by the CBI at this point will be totally illegal and beyond any legal principles affecting the federal structure of the nation. The actor said it should be the Maharashtra police and not the police of Bihar who should have jurisdiction over any case relating to Rajput as he died in Mumbai. The Bihar government transferred a case with which it had no jurisdiction to investigate to CBI instead of the Mumbai police, she added in a statement. Chakraborty has consistently opposed the CBI or Bihar police taking over the investigation. The government of Maharashtra has also opposed the need for a CBI inquiry, saying the move encroached upon the rights of another state and that they are yet to give their approval to the investigation. As per the rules, the agency cannot question people in the state without the state government's acceptance, they have said. In July, Rajput's father Krishna Kumar Singh had filed an FIR against Chakraborty, accusing her of cheating his son and driving him to suicide. His FIR alleged that Rs 15 crore was siphoned off from Rajput's account in 1 year to bank accounts of persons not known or connected to the late actor. Well, that's all we have time for in this edition of News Broadcast. Do subscribe to us on a YouTube channel and also follow us on Facebook and Twitter as well. And stay updated with the latest from across the world, the country, the region and from the state as well. Meanwhile, stay safe, practice safe health hygiene and maintain social distancing wherever you are. But most importantly, take good care of yourself and your loved ones. Thanks for watching.